No komar yad wa mer yad ya. No war mer war nyim da. Yan wa mer war nyim wa mer gwa kete. Wa ka wa mon yon ngu. Ke me ta kom. A war ye be ta kom. Ya til mang tong ma ta wa mer kar wa rok tai wa. Ro te bem til kai ma tong. Ya til mang tong ma ta wa mer kar wa rok tai wa. Ye mo da ya wo kai ma tong. Ya til mang tong ma ta wa mer kar wa rok tai wa. Ye mo da nya yin ma tong. Ya til mang tong ma ta wa mer kar wa rok tai wa. Ye mo da ya wo yin ma tong ba. Ya til mang tong ma ta wa mer kar wa rok tai wa. Til mang tong ma ta wa mer kar wa rok tai wa. Ye mo da ya wo kai ma tong ya. Ya til mang tong ma ta wa mer kar wa rok tai wa. Ye mo da ya wo yin ma tong. Ya dang. Mana na be wan ma jara won we. Mene kai gwa gwa. Inga mene wa ke do ar yar ga mene mi ar ya. No te la be wan ma jara won we. Mene kai gwa gwa. Inga mene wa mi ar yar ga mene ke do ar ya. Ar yar wan ma jara won. Mene kai gwa gwa. Mene wa mi ar yar ga mene ke do ar ya. No te la be wan ma jara won we. Wan ma ga wo. Ma kai gwa gwa. Inga mene wa mi yar kom ga mene ke yar kom. O kom be wan ma jara won we. Waka wa puri. A war ye pete ko. Wini pul. Ma ma ba ba. Mon me jara wi mo ti o ba. Ma we de bi wa ma wa ti jara wi ro. Mon me jara wi mo ti o jara ya. Ma we de bi wa ma
Hello.
wa ti jara wi ro.
Ladies and gentlemen, the ambassador is here. The ambassador has arrived. And we just have a brief group of people who are welcoming the ambassador to come and be with us. The welcoming party for the ambassador is here. She has arrived. Like I said, let us keep movement to a minimum, especially behind the ambassador's tent. Members, please make sure you don't come around the tent. If you're leaving that point, please do not crowd the ambassador's tent. Those of us who have been invited, please come and take your seats. Let us take our seats and be ready to welcome the ambassador. There's a team that is welcoming the ambassador. She's coming to access her seat at the tent. Like I said, people do not move around the ambassador's tent. Please do not move around that tent. Go around the long route if you want to access the facilities. Her Excellency, Ambassador Natalie Brown, you're welcome. You're welcome to Pajule. Welcome to Pade District. Specifically, you're welcome to Pajule Health Center 4. Other members, please go to your seats. You go and take your seats. And the team. All right. Thank you very much. Our ambassador, our guest of honor, has taken our seat. Can you now slow down? Yes. All right. Thank you very much. Ladies and gentlemen, like mentioned earlier, this is a very brief but very important function. Our guest of honor is here. Her Excellency, the Ambassador, U.S. Ambassador to Uganda. Your Excellency, you're welcome. Thank you for coming to Pade. Thank you for coming to Northern Uganda. Like I said, this is a handover ceremony. This is basically a handover ceremony of renovated and refurbished maternity units and the surgical theater. And this was done through support from the American people, through USAID, on the project Regional Health Integration to Enhance Services North, Rights in Acholi activity. And it has been done at 3 sites, okay? And we have this site here, Pajule Health Center 4, and Ogom Health Center 3 in Pade District. And there's another site, Namakora Health Center 4 in Kitgum District. So the local leadership from those 2 districts are here with us. And at some point, they will be making their brief remarks. But just to let you know, we are going to have a brief ceremony to officially unveil the plaque and cut the tape at the maternity unit. And thereafter, we shall have a tree planting session of about a minute or so. And then we shall come back here where we shall have our speeches. And like I said earlier to our team, I only request very few people to accompany our guests to that point. And in this case, I'm asking the representative of the Ministry of Health, seated next to you there on your left, who will be moving with you. The in-charge of Pajule Health Center 4 is next to you as well in your tent. The Chief of Party for Rights North Acholi activity is also next to you there. The DHO of Pade, the LC5 chairpersons for Kitgum and Pade, the RDC for Kitgum and Pade, and the chair of the DHOs. Please, you will accompany the ambassador to that point at the maternity unit. And of course, I will ask the in-charge, Dr. Dennis, you will lead the team at that point. So at this juncture, without wasting time, Your Excellency, can we take leave so that we go on and cut the tape, unveil the plug? The rest of us, please stay here and wait. There's a live feed that you can be watching on our television screen here. So that just take your seats, and like I insist, keep your movements to a minimum, keep your phone calls on low, so that we do not have interrupted movement as we move along. So the ambassador is moving with the team accompanying them. Some of you may just have to wait outside the maternity unit, the operating theater. You may not all have the gear required to enter. So those of you who have accompanied the ambassador, you just stand and wait outside. When they finish, then you'll return to site, and we shall continue with our program. Thank you.
30 referrals per month to other districts, Kitgum or Gulu. Mobilized. But now, no longer, you don't have to go to Kitgum, you no longer have to go to Gulu. The lighting in the theater. But with the generator in place, you have that power that supplies the whole facility. So we're so grateful to the American people for this support.
Simba mutichira vikakati.
Njagala tukati
Watering, you want that?
You can water it.
Yeah.
The water. Oh, wow.
For the people over there.
Thank you so much.
It's evergreen. Evergreen.
Make sure you take care of it
Sure.
as a memory symbol.
Don't touch it. Look at the picture there. The ambassador. Now can you extend a little bit back? Gauss?
Twende tupate, twende tupate, twende tupate, twende tupate. Twende tupate, twende tupate, twende tupate.
Slick Stewart and Roger.
Hello. Thank you very much, ladies and gentlemen. Well, welcome to our function. It has already started by the activity of unveiling the plug, cutting the tape. And I know High Excellency, the ambassador, was taken through a tour of the renovated facility. Like we said, this is a handover function of the renovated facilities and maternity units and the surgical operating theater here in Pajule Health Center 4, but it is a symbolic representation of the other sites at Ogom Health Center 3 and Namukora Health Center 4 as well. That was done with support from the American people through the Regional Health Integration to Enhance Services North, the actually activity that did this activity. Now, it was basically construction and rehabilitation of these premises, and it is here in Pajule Town Council in Pade District. We have a group of persons here. We have members of residents in this area. We also have the local government leaders of the two districts of Pade and Kitgum here with us. I'm talking about the LC5 chairpersons, the RDCs, the chief administrative officers, the district health officers of this, in these districts. We also have representation from the Ministry of Health, like I said, and also the team from Rights North here with us. I will be following the program, and ladies and gentlemen, this is the time for us to make our brief remarks. And please, like I said, keep it brief. Let us remain seated, let us minimize movement so that we do not disrupt ourselves and we have a successful function. I am informed that the LC1 chairperson of this village, Lilla village here in Pajule Town Council, is around. I'll invite you at some point, so be ready. Before that, ladies and gentlemen, I would ask all of us to stand up and we sing the national anthem. And after the national anthem, I'll invite the parish priest for Pajule Catholic Parish to say a word of prayer, and then we shall continue with our speeches. Let us have the national anthem, please. Remain standing for a word of prayer, and that will be said by the Reverend.
Our help comes from the Lord. We are in your presence this morning. We thank you for all the blessings you have given your will. We now invoke your blessings upon this gathering. Bless all the members present here. Bless our benefactors. Bless all the medical personnel and all those who will get glorification of your name on earth and the sanctification of souls. Through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit.
Pajule Town Council to welcome us to his space. Chairperson, very briefly, please.
For a minister, Maloy Lokom Yotkom, for your William Workere, for your Rod Matikianwa, we come a beach my part Magiwaki district, Mamewa Kidgumki Kine, Kilo Taylor my part Wang, Jomaki Yerga, Yerka Chilki, Jomaki Choegi, Doctis, Kilo dear police Magiti Kine. Ya Yoma the Canano, Minister Mamewa Maloy Lokom Yotkom, Tino Oki, what Mamega, Mati Pajule Town Council. Ilila village Ipade district. Ana pe ki lok mama pol mamero a lok kan dita jolo mego ma dira da jolo en to wan me donyo tin ki won ma mega mana yang no be pangiyo ni mego rom donyo borra kan a winyo nyie ki radio be no pangiyo na bineno wakome chiketa tina ne ko o kanya ngiri je ma suspect wati ye nyo bek wati yo bitime yari ya ma mewani lega wati ya chiel mego mapuya mede ki log mapul kita komidu o kan wek ruwa me od yat wane ki met ku chet malo piani kur ka wabiru nen diet matika bon ku mom tera da ene transport cha weng mi chwalo dan ti jomo ken magi gor ma piram cher kanyabu sika ki mero od yat do hospital angeni pero ma wanju pade ubi dogon pere dong lega na na ma chiel no kidong lega na mi ario atika winyo je ma beru meguni wek gin ma chalo mono ku bet pe piani na chi pa me Uganda dog pin pian tu mi korona ne ruenyo anyol mi lobu ni dog pin to twal chi wa pe ki kir lok mo mapul ana jula jola program ma miu alega lo tela ma mega magi dong yo program ma duong mi konye pe an mi dur lo mapul ana julu wa jola.
He was saying is very appreciative. The team, the LC1 team, and the peoples of Lilla village are very appreciative of the hospital, and especially the refurbishment and the remodeling works that have been done. But he is also appealing that because of the distances and the services, access to service that is challenging for the people here, if this is to the minister really, if the status could be elevated to a district hospital. So he's happy that this hospital has been supported. So thank you very much, LC1 chairperson. I would like to now invite the in-charge.
The Honorable Hankitgum, the Chief of Party, right north actually. Your Excellency, Pajule Health Center 4 is located in. The expected number of pregnancies per year stands at 1,366 pregnancies per year, which is significant. 53, we have a staff not fully functional because of the industrial action that is going on by the Allied Health Professionals Council. It has seriously grounded and affected outpatient service delivery. Currently, the service delivery that is going on is only emergency services and in the maternity section. Your Excellency, with great pleasure, that we now have a modern, much bigger operating theater, which is fully equipped with the modern state-of-the-art machines. We also have got modern operating theater at Namukora Health Center 4 in Kitgum and another maternity ward at Ogom Health Center 3. With these facilities in place, this will greatly improve maternal and child health services in the district, and it will put an end to the high number of referrals of expectant mothers to the nearer district to access operations. We are very grateful to the American people for the generous support with this development. However, through the Chief Administrative Officer of PADER and the Minister of Health of Uganda, I would like to request that where possible, you could further support us yet with a bigger and spacious maternity ward and a neonatal intensive care unit. This could further reduce the number of referrals of these neonatal babies, and it will generally improve patient care. I would also like to request the government of Uganda to consider increasing the wage bill for Pader district to help reduce the staffing gap, and also to consider granting a district hospital status to Pader district so as to widen the scope of health services for the people of Pader. Your Excellency, please convey our appreciation to your government for the great support you've rendered to us, as we look forward to a future support from the US government, especially in the areas of infrastructure challenge that I've highlighted above. God bless the American people, for God and my country. Thank you so much.
Thank you. Thank you, Dr. Dennis, the in-charge of Pajule Health Center 4, for your elaborate and precise speech. I will not water it down. I would like to invite the DHO, the District Health Officer of Pade District, Ms. Ann Apio. To all the other speakers who are coming from here on, we needed him to have time to explain what goes on in Pajule Health Center 4. But the rest of us who are making remarks, please Let's make them very, very briefly. Very, very briefly. You're welcome.
Thank you so much. Your Excellency the Ambassador, the Honorable Minister, the Honorable Members of Parliament, the Chief of Party, the district leadership from all the districts represented here, the RDCs from Kitgum and Pade, the chairpersons from Kitgum, Pade, the LC3 chairpersons from Pajule, sub-county, the mayor, the LC3 from Ogom, sub-county, the director, regional referral hospital, and in charges of health facilities present, the representatives from Rights North Acholi, the chair DHOs from Acholi sub-region, ladies and gentlemen, good morning. Now, on behalf of Pade District Local Government and the entire health workforce, I would like to join the rest of the health in welcoming you for this very important event. That is official commissioning of Pajule Center for Theatre, the Air Center 4 at Namokora, and maternity block at Ogom, sub-county. Pade district, with a total population of 203,700,000, does not have a district hospital. Pajule Center 4 is the highest level of care. And Pajule Center 4 and Ogome Center 3 benefited from the Rights North Acholi under support and strategies of health system strengthening. With the grant from the US government, constructed the state-of-the-art facilities in both facilities, which we really appreciate you for this. We as Pade District Local Government, we are grateful and applaud the support to our communities of Pade and the surrounding evidence by the data we are receiving. Like the OPD attendance has increased, the deliveries has also greatly increased, especially in both facilities, including even the number of cesarean sections. Initially, we were not conducting any refurbishment, but as I talk now, in the month of April, we had a total of 13 cesarean sections done, which is really a great, great achievement. When you look at the data for GOM, let me cut the story short, but from the month of Jan, we have been realizing great number of mothers turning up for deliveries. In Jan, we had a total of 37. In Feb, this financial year, we had 38. Then in March and April, we had 34, which shows that the facilities are being used greatly. So though the theater at Pajule Center 4, we have been able to reduce, through the facility here, we have been able to reduce on the numbers of referrals to other neighboring districts like Kitgum, Agago, Lira, and Gulu City. Likewise, the distance covered by our mothers have been shortened. Her cesarean section is already being done successfully. And this has made great reduction in the number of perinatal mortalities. On behalf of Pade District Local Government, more especially Health Department, and communities of Pade at large, I would like to extend our special appreciation to the government of the United States of America through our partner on the ground, Rights North Acholi, under the program of health system strengthening, for providing the state-of-the-art design for these facilities for the people of Pade. Today, the facilities are being handed over to us. That means we need to budget for the resources for operation and maintenance for the structure and equipment in both health facilities. I now call upon the in-charges of the facilities as well as the entire health workforce to provide the required oversight for the proper handling and safety of this equipment and the health facilities as a whole. Lastly, I would like to thank everyone who made this day so colorful, and the day has really come to pass. I know we started this sometimes back, but with the problem of COVID, we could not have this done. But today, I'm happy that Your Excellency, you are here to see this commissioning of the health centers in our district. Thank you so much.
Thank you. Thank you, Ms. Anna Pio. Thank you for your remarks. That's the DHO of Pade. Like I said, I'll still remind the persons who are coming over, if you have a long speech more than a page or two, please start summarizing it. You have time. Get your pen out and start editing. I would like to invite our Chief of Party, right North Acholi, Dr. Dithan Chiraga, to come and make his brief remark. Dr. Dithan.
Your Excellency, the U.S. Ambassador to Uganda, the Honorable Minister of Health, Honorable Members of Parliament present, Minister of Health officials, district leaders, distinguished guests, and all participants, good morning. The USAID Regional Health Integration to Enhance Services, North Acholi, is currently in its 5th year of implementation. And we do support programs within the Acholi sub-region. Together with district partners, we continue to support all the 8 districts in the sub-region. And the support that we provide is in the areas of HIV, TB, malaria, nutrition, WASH, reproductive health, family planning, COVID-19 support, as well as maternal and newborn care. Now, as part of the local partner transition efforts, in October last year, the implementation of TB and HIV services in the region was transitioned to the local partner health services and Kole Acholi that is managed by TASO, a local partner organization under USAID. Previously, we had transitioned PNFP service delivery for HIV and TB to LSTA, the local service delivery activity, under UPMB. And October this year, we plan to transition service delivery for family health activities to the local government. Now, in terms of the story for the construction works on maternity wards and theaters within the 2 districts, we began this effort in May 2021. Through a competitive process, we were awarded a local company, ARC Construction Services, to undertake these construction activities. So the whole effort has taken just over a year. And in Namakora Health Center, we repaired the operating theater, the maternity ward, and a covered walkway between the 2 buildings. We also installed a complete solar-powered water supply system with an elevated 40,000-liter water tank. We built a generator house and a placenta pit. At Pajule, as we've just noticed today, we refurbished the operating theater, added a walkway between the maternity and the theater, and constructed a placenta pit. In addition to that, we installed water supply, including a submersible solar pump and an elevated 40,000-liter water tank. At our Gom Health Center, we constructed a maternity ward from scratch, a placenta pit, and a 4-stance pit latrine. We motorized the existing borehole using solar-powered water supply systems with an elevated 20,000-liter water tank. Now, in terms of the monitoring and supervision of these construction works, we partnered with MBW Consulting to supervise the construction works, and this was done on a bi-weekly basis. district and health facility partners were involved in these supervision visits. We held monthly site management meetings with all the stakeholders. The supervision including ascertaining that the building specifications are done according to the Ministry of Health guidelines. We also had equipment installation and verification meetings with the partners. So through this generous USAID grant and support, we completed the construction works, but we also equipped these theaters and maternity wards with state-of-the-art equipment and materials. So in January this year, we opened these facilities to the local population, and we've seen a remarkable increase in the utilization of these services. So we are grateful for this continued partnership of the district authorities and USAID. We hope to continue to work together to improve maternal and child health services in the Acholi sub-region. Thank you so much.
Thank you. Thank you, Dr. Dithan. That is our Chief of Party Rights, enumerating the achievements that they have made, especially as far as these centers are concerned. I would like to invite our next speaker. The Honorable Arwai Christopher Obol is the chairperson LC5 of Kitgum District, but specifically here he is speaking as the chairman of the organizing committee for this function. So Honorable, you're welcome as chairman for this matter.
The U.S. Ambassador to Uganda, honorable members of parliament here present, commissioners from the Ministry of Health present, the resident district commissioners, the district chairpersons, honorable councillors, chief administrative officers, chief of party rights, not Acholi, all implementing partners present, district health officers, health workers, ladies and gentlemen, good morning. I am Arwai Christopher Ball, LC5 chairperson, Kitgum District, at the same time, the chairperson, Central Organizing Committee. Before I proceed to my speech, I want to quickly acknowledge the contribution and the commitment shown by the members of the Central Organizing Committee, members who participated in the organization of this ceremony. Please wave to Your Excellency. Thank you so much. Also want to recognize the team that came from Namokora. I think you are aware today as we have this celebration, we look at Pade and Kitgum District. Specifically, in Kitgum District, Namokora Health Center 4, which also has the same facilities renovated. Team from Namokora, led by Mayor, Town Council Namokora, rise up for recognition, and thank you so much for coming. Today, we come here to witness Handover operating theaters and maternity blocks in Kitgum and Pade districts, renovated with general support of the American people through our agency, the United States for International Development. Aware that the region suffered the long rebellion of the Lord's Resistance Army that waged war, and all the districts in the region suffered equal effects. The war left a lot of systems and infrastructure damaged. Years after cessation of civil strife, the region still lacks in terms of health performance indicators, which I've enumerated. I'm not going to go up to the details. But to improve the quality of health services in the region, the Ministry of Health, in partnership with United States Agency for International Development, regional health integration to enhance services, not right, actually, together with Kitgum and Pade District Local Government, has renovated operating theaters at Pajule and Namokora Health Center 4, and constructed maternity blocks at Rugom Health Center 3 and Namokora Health Center 4. These facilities will provide enhanced services for the community and will also allow the health centers to keep up with the high demand for medical care. Today, the opening of the new facilities is an important milestone for the two districts. We have so much to celebrate. It is a brilliant investment that will make a direct and immediate improvement for the health centers and our patients. Accomplishing these goals required amazing teamwork and trust, resulting in the state-of-the-art health facilities that we are so proud of. Cognizant that in the East Acholi sub-region, there is one public hospital, Kitgum General Hospital, serving a population close to 1 million, and in the West Acholi sub-region, equally, there is one public hospital, that is Anaka Hospital, which portrays a significant gap in quality service delivery. Your Excellency, with exciting possibilities for strategic partnership on the horizon, we envision an even greater ability to improve healthcare. Today, it is a great time to be at a launch which in essence is a celebration of success. Against this background, therefore, on my own behalf and on behalf of Kitgum and the district local governments, I would like to honestly thank Rights North Acholi and the generous contribution of the American taxpayers for this support. We pledge to use the support appropriately and ensure the sustainability of the services extended to our beloved people. Thank you so much for stepping up to make life better for our patients and the community. Together, we are safer. Together, we are stronger. Together, we make a difference in lives of our patients and families. Together, we will fulfill our promise that is securing health for the community. Thank you so much for your sustained partnership, and we shall continue in the same vein. I say this for God and my country.
Thank you, Chairperson, Organizing Committee. But you cannot separate and remove the LC5 chairperson from the chairman organizing committee. But thank you, Honorable. I would like to invite the COW, the Chief Administrative Officer of PADE, the Chief Technical Officer of the district, to come and give very, very, very brief remark. And I would like to alert the LC5 chairperson of PADE to get ready after his COW has spoken.
The U.S. Ambassador, Minister of State for Health present, and all protocol observed. Padere District was created from Kitgum District on 14th December 2002. The district of Padere has 13 health center 3s, 24 health center 2s, and 1 health sub-district, health center 4. Administratively, the district has 2 counties, 18 sub-counties, 5 town councils, 97 parishes, and 877 villages. Funding to Pajule Health Center 4, the facility receives a PHC of 17 million quarterly and RBF fund, which is not adequate to address the activities to be undertaken in the Pajule Health Center 4. This, therefore, calls for more donor and development partner support if the health service delivery is to be enhanced. However, the district appreciates the American people through USAID mission and Rights North for their contribution made towards health system strengthening in the district, and also appreciates the contribution of 2.6 billion of budget support which has been injected in the 2 projects undertaken in the district. So far, the achievements undertaken by Rights North in the district include: 1, under Rights North support, the district benefited from the construction of a maternity block in Ogom Health Center 4, and under the North Rights, it has also rehabilitated the theater here in the Pajule Health Center 4, And the district has seconded 2 doctors to the health sub-district, which has functionalized the operation of the theater. We also thank you for the donation of the vehicle and assorted equipment to the health department. Rights North, with support also from the Ministry of Health and Gulu Regional Referral Hospital, conducted a surgical camp which enhanced the health workers' skills and to functionalize the theater. With the support from North Side Rights, data management and capacity building for reporting has improved. This has been enhanced through the support towards the data management equipment, training of the information management assistants, and performance review meetings held where health facility in charges have shared their challenges, drawn strategies that have enabled the district to improve its performance in reporting at the national level. In addition, Rights North has enhanced the family health indicators in the district through the contribution to maternal child health indicators done through the targeted training to health workers. Also, with support from Rights North, the district emerged the best in the previous COVID-19 vaccination exercise, and the district also requests Rights and other partners to continue providing the backup support also in other programs like Child Days, among others. The district recently recruited and deployed health workers, especially midwives, who have been deployed to Ogom and Pajule Center 4 to enhance maternity, especially in the critical areas of doctors, midwives, and nurses. The district also faces a challenge of weak referral system, which is served by 1 ambulance, coupled with bad roads and hard-to-reach areas. And our recommendations are that the Ministry of Health, Rights North, and other development partners to consider investing in infrastructure, that is staff house construction, rehabilitation of health facilities, construction of health facilities in new administrative units, among others, donation of another ambulance to Pajule Center 4 to be located in Aware Health Center 3 for better emergency response, Ministry of Health to consider lobbying for more funding. And in conclusion, the district recognizes and appreciates all the support provided to the district from the U.S. Mission through Rights North and Ministry of Health. Thank you very much for God and my country.
Thank you, Cow. The Cow of Pade, Mr. Alex Chelimo. Thank you very much. I now invite the LC5 Pade. Like I said, some of the statistics, some of these things are repetitive, really. And it has been captured earlier. So can we just try and highlight our appreciation briefly so that we can conclude? You can see the weather may not be on our side. So the LC5 chairperson per day, the Honorable Christopher Fearless Oboya. You're welcome. Or is it, I've missed the other beat. It's just Fearless Oboya. Oh, Honorable Fearless Oboya.
Ministry of Health officials, members of parliament present, SIP of party, Rights North, and your team, political leaders, both at higher and lower local government level, technical staff present, development partners, ladies and gentlemen. I'm not going to repeat what have already been said. And this goes directly to the Minister of Health present with us. Honorable Minister, the District of Pade still experience a lot of challenges in areas of medical. The biggest is, as you see the district, big cities, with the population which has already been given to you, we still don't have hospital, district hospital. And the nearest district hospital we can get service is about 100 kilometers away from here. This makes our people very vulnerable to unnecessary deaths which could have been prevented. I therefore request you kindly, Mr. Minister, these facilities where we are in, Pajule Health Center 4 is the biggest health facility in the district. I humbly request, we have written letters and letters to the ministry that Pade should get district hospital. I humbly request this facility with all it has now is just a step to make it be a district hospital. Pajule Health Center 4 to district hospital. And this is our priority as of now. Where the Health Center 4 is situated has enough land to accommodate district hospital. The maternity block in the health facility has attracted a big population of mothers at the demand. However, the health facility experiencing the problem of accommodation. The maternity unit, which has capacity of 5 beds, has become small with high numbers. Some mothers have to lie on the floor due to limited bed capacity. The district requests Rights North to consider constructing a modern maternity block which can match the current demand. Weak referral mechanism of patients from our health center 4 here to the either hospital district or to referral district. Referral hospital. Further still, given the catchment area covered by Pajule Health Center 4, the district requests for another ambulance to reduce the time taken for a patient to reach hospital timely. This is because sometimes one which we have, you find it has taken a patient for referral and it has not yet come back. Then behind here, there is another emergency which we have to wait for that one ambulance to come back in order to make us transfer that patient. So we humbly request maybe one more ambulance be added to Health Center 4 here, which can help us transfer our patient faster. All buildings at Pajule Health Center 4. In addition, Pajule Health Center 4 is a very old facility with generally very old structures. I appeal to the Minister of Health to consider a general rehabilitation of the Health Center 4, which is also serving as the district hospital. These documents you give to, yeah. In conclusion, I wish to appreciate the Ministry of Health, Gulo Regional Referral Hospital, U.S. Mission through Rights Notes for the financial and technical support respectively rendered to the district for God and my country.
Thank you.
My names are, I'm retired Colonel Fearless Oboyat, the chairperson of the district local government. Thank you.
Thank you, Honorable Chairman. Thank you very much for your direct and straightforward speech. Yes, we are going to give a copy of your speech to the Minister and to Her Excellency the Ambassador. Your Excellency, just one more person before I invite you. I would like to call upon the RDC of Pade, Mr. Milton Odon. Please, Bwana RDC, very briefly, very briefly, as we conclude this section of our speeches, so that we invite our chief guest to make her remarks.
Your Excellency, the U.S. Ambassador, we were chief guests, the Ministry of Health, Gum and Pader District, the Honorable Member of Parliament, President who has just arrived, I also want, in a special way, to recognize Chief of Party, Right Pajule, the cluster manager, all the staff, invited guests, ladies and gentlemen. My name is Hamilton Odon, the resident district commissioner, Pader District. I also recognize the resident district commissioner representing His Excellency the President. Therefore, I'm here to receive you on behalf of His Excellency the President of the Republic of Uganda. You're most welcome. Our chief guest, I want from the American government for the support in these 3 health facilities that we are commissioning today. I thank you and the American government in a special way. Our chief guest, this is in line with the government of Uganda policy of improving on health facilities and welfare, the health of the people of Uganda. I would like to assure you, our chief guest, that the facilities that have been constructed and rehabilitated will be put into better use. We shall maintain, we shall keep, and it will last for a long time. Finally, I would like to assure you, our chief guest, and every gathering here, that we have patriotic and committed health workers who are going to be responsible for these facilities in the 3 areas in the place. Last but not least, I thank everybody who have come for this ceremony. I thank you for the work you have done that has made this ceremony a success. The strong relationship and cooperation between the government of Uganda and America, and this has always been, and it will remain forever and ever. I say this for God and my country.
Thank you, sir. Thank you very much for your brief speech. Ladies and gentlemen, you will allow me now to come to the most important bit of it, that is inviting our chief guest to come and speak with us. And she is none other than the U.S. Ambassador to Uganda, Her Excellency Ambassador Natalie Brown. As she's coming over, I would like to recognize in our presence the arrival of the area MP, the MP for Aru North, where we are, Honorable Komakech Christopher. You're welcome. Thank you for coming and being with us. Your Excellency, you're welcome to speak to us.
Should I sanitize? Thank you, thank you. Good morning, everyone. It's a honorable representative of the Minister of Health, members of Parliament present, honorable RDC, all of the local officials from Kitgum, Pader, and Namakura. I think all of the staff of this health center. These are the true people to recognize today. And certainly I want to acknowledge all of the community members who came out to join us. Thank you. Oh, and I apologize, Dr. Dennis, and certainly the Chief of Party of the Rights Project, Dr. Ditham. I am deeply honored to be with you here today on this significant occasion for the handover of the renovated and fully furnished facilities here in Pajule, Health Center 4, but also, as you heard, in Ogum Health Center 3 in Pader District, and Namakura Health Center 4 in Kitgum District. As you've heard from some of the other speakers who preceded me, These renovations have already transformed the maternity units and the lives of mothers delivering in the community. They can now more easily provide quality antenatal, delivery, and postnatal care services. And for example, you can see in the background that there's an improved water system, and so this means the facilities always have running water. And here in Pajule, as you've heard, the facilities are already making a difference in the lives of so many, averaging 120 deliveries a month, including 10 cesarean section deliveries. And this represents a 30% increase over the services they were previously able to provide. We've seen similar increases at the Namakura Health Center 4, which delivered 145 babies in January compared to 95 in November. And deliveries at Ogam's facility more than quadrupled from November to January. I want to congratulate everyone who contributed to the successful renovations. This includes USAID, the U.S. Agency for International Development's Rights and Chole North, or Rights North and Chole, which means Regional Health Integration to Enhance Services, the health center in charges, and the health unit committees for the 3 facilities, all of the district health officers of Padre and Kitgum districts, and the health unit committees. My team has spoke highly of the strong collaboration and the leadership they saw, and I hope this continues. I also urge you to maintain the momentum you've built through this process. Use this momentum to ensure the facility serves the community, is properly maintained, and when needed, improved. Your hard work has the potential to not only prevent deaths, but also to bring new life into the world and to do that safely. And these renovations are tangible evidence of the United States government's commitment to the people of Uganda, to promoting their well-being and improving their prospects for the future. Delivering quality health services is fundamental to this, and the 4.6 billion shilling investment required to make these renovations is for partnership. Among the successes, we've seen reduced maternal and neonatal mortality, improved HIV/AIDS control, and reduced mortality from malaria. We've taken strides in infectious disease outbreak response, including Ebola. I just say on COVID, and we heard of the increase in COVID vaccination rates, and I know that there's a table over before the operating center offering COVID vaccines. I just want to remind everyone that COVID continues to remain a threat. So again, get vaccinated, not just vaccinated, fully vaccinated, and that means for many of the vaccines available, 2 doses. And if it's been 4 months since your vaccine, get a booster. I've now had 2 boosters. We know the vaccines are safe, they're effective, they save lives. So encourage your friends, your families, and all of those who are important to you to take the opportunity to get vaccinated. The United States, in addition to the health support we've discussed today, has made available just under 16 million vaccine doses to the people of Uganda, as well as support to get the vaccines to the communities to need to do so without masks, and to get back to all of the activities we previously enjoyed. And speaking of the activities, I mean, there's nothing that I like better as the U.S. ambassador is being able to come out in communities for events like this. It's really rewarding when celebrations, quite literally open doors for citizens to lead healthier lives. So the improved facilities here in Kitgum and Padre districts are a testament to our continued joint efforts to invest in the people of Uganda. I want to thank you for welcoming me and my colleagues here today. Thank you for your commitment to your community, and thank you for the strong partnership between the American and Ugandan people. We look forward to continuing it. Thank you.
Thank you, Your Excellency. Thank you very much for your speech. Like I said, ladies and gentlemen, she has spoken on behalf of those who have supported us, the American people. I would now like to invite the representative from the Ministry of Health, representing the Minister of Health here, who is our director, Dr. Moses Mwanga, to come and speak on behalf of the Ministry of Health and the government of Uganda as the receiver of the refurbished facilities. Doctor, you're welcome.
Hello. Your Excellency, the U.S. Ambassador to Uganda, the Member of Parliament, the Chief of Party, the Residence Commissioners, the Director of Regional Referral Hospital, the District Chairpersons, the Chief Administrative Officer, the DHO, the staffs of Pajule, the implementing partners, Chief of Party, the registrars of councils, different partners, the commissioners, the community, and my staffs. I have the pleasure to represent the Ministry of Health. She was supposed to come, but at the last minute, she was called for a state function. Before I deliver her speech, Dr. Mwanga Moses, the Assistant Commissioner, Health Services, Ministry of Health. I bring appreciation from Ministry of Health. Before that, I want to appreciate the U.S. government for all the support in the health system under the USAID partners. Colleagues and partners, especially the local authorities, we are more than humbled to receive the facilities in this district. The maternity services, the theaters, the equipment, the water system, the walkways, to mention a few. I think we are so lucky. We should appreciate that on behalf of government. I want to acknowledge all the players in this as a commissioner from Health Service before I read the minister's speech. We are humbled because health system has been one of the challenges, especially in these areas. In terms of maternity, we have been, as you have heard from all the speakers, assisted in helping the maternity services. The referrals have decreased. I want to appreciate the regional referral of Gulu. I think they have played a very big role in this area. I'm told the director is around. Thank you so much. Please tell your staffs for the work well done. I also want to appreciate the staffs, Dr. Dennis and the staffs. Please, we want to thank you so much. Receive whatever you have received in terms of infrastructure, the equipment. This equipment is very expensive. And I'm sure in this area, including Gulu Regional Referral Hospital, they can say it that you have very good equipment and you may be having the state-of-art theater. We want to appreciate that. So please, Dr. Dennis and the staffs, be there for the patients. Equipment is one and infrastructure, but what makes a facility and a health center is the staffs themselves. Be there, use this equipment, and have a smile for the patients. The local councils, I want to appreciate on behalf of the ministry for having put this in use. Your coordination under the chairperson LC5 has helped bring whatever we are receiving today to maturity. Thank you so much for coordinating under the guidance of the Chief of Party, Rights North. Thank you so much for the support on behalf of Ministry of Health. The training, the support, these people still need much more of that. Doctor of Rights, please support them in one way to ensure that support supervision is done and whatever has been donated is put in right. Under the Ministry of Health, I've taken note of whatever you have brought on board. Pajule is a health center for. With all this in place, I want to assure you I'm going to discuss with my team and then we'll see how we can elevate health center for to a district hospital. But the local district council, the COW, has a very big role to play. Ministry of Health is directly in charge of regional referral hospitals. The district hospitals and health center fours are under the mandate of the COW, the district. So if the area has decided that a Padel can be elevated to a health center, to a district hospital, then we can take it on. The structures of district hospitals has been elevated. Now, if it becomes a district hospital, then it has the mandate of improving its human resource structure. They are supposed to have more than one medical officer. I want to thank the medical officer on ground for the work well done, but he can't work alone. So we want to work with the COW to ensure that at least 2 medical officers are sent to this facility to ensure that that facility is functional. This young man cannot work 24/10. He needs a support. We are supplying medicines under Health Center 4 for Health Center 4 under credit line, Ministry of Health. I'm sure this medicine will continue. The mere fact that you have got a theater on board, we are going to look at how we revise the medicine package to this facility. The budget of the government district hospital has been improved, so we have to lobby to ensure that Padel Health Center 4 becomes a district hospital. For the partners, I want to thank you so much for the work well done as Minister of Health. We need to work to ensure that we strengthen that. The regional referral of Gulu has an emergency referral system, and there are some ambulances attached to the regional referral. COW get in touch with the director, Gulu Regional Referral, to ensure how Padel can tap in that referral system for the patients. I've taken note of the challenges, and I'm going to share them with the minister who delegated me. Now at this juncture, I want to deliver the speech of the Honorable Minister of Health on the inauguration of the constructed health facility at Padel and Chitugum District, Arua Sub-Region. Dr. Ruth Achen, today on the 25th, 2022. Protocol observed, Your Excellency, Honorable Member of Parliament, US, the Deputy Mission Director, URC Vice Chairperson, Chief Administrative Officer, Residence District Commissioner, the Director of the Regional Referral, District Chairperson, the COW, ladies and gentlemen. I'm delighted and honored to take this opportunity to welcome you all to the in Padel, Chitgum, Acholi sub-region. Ladies and gentlemen, as you all know, the last 2 years have been affected by COVID-19 response activity affecting access to quality health care in the region. The launch of this health facility in Padel and Chitgum comes at a time when we most need them to deliver quality services. The renovation and the construction of this facility and a maternity block in this area, especially by the Lord-resistant army, that affected the Acholi sub-region, leaving the whole system and the infrastructure damaged. To the planners in the sub-region, as a means of improving quality of services, this inauguration is an avenue for us to mobilize support, resources, and attention from leaders and financing actors. The renovation of the operating theater at Pajule and Namakola Health Center 4 and constructed maternity blocks at Ongom Health Center 3 and Namakola Health Center 4 are evidences of the mobilization and the support from the partners. Ladies and gentlemen, from the statistics which all our members have presented, my appeal is to call upon everybody. Remain focused. Just as Your Excellency told us, the pandemic is still around. COVID is still with us. I'm happy to note that people here have responded to the vaccination. Please take it seriously and ensure that everybody gets the 2 doses of vaccine. Continue implementing the preventive measures, including hand washing, use of face masks, social and physical distancing. It is at this juncture, therefore, I would like to reiterate my ministry resolution to engage all stakeholders to ensure support to the region. Evidence-based strategies are effectively and equitably optimized for better outcome as we move towards the universal health coverage. I'd like sincerely to appreciate the District Local Council of Chittagong and Padel and the USAID rights together to ensure that the operating theater at Pajule and Namakola Health Center 4 and the constructed maternity blocks are done. I applaud and I appreciate most especially the US government. Your Excellency, we are more than happy for the support from the government in all our health systems. Thank you very much. Thank the American people for supporting the Ugandan government. The Ministry of Health will continue supporting the facility in terms of medicine in the credit line, and I want to ensure you that this package will increase. We'll also support in terms of staffs, and I call upon the district to plan with the Ministry of Health to ensure that some of these challenges are put to an end. Allow me, ladies and gentlemen, to recognize the organization and the projects that have contributed greatly to the healthcare services in Acholi sub-region. The URC, the University Research Council, through various research-supported projects, Right North Acholi, and other sister projects. Thank you for that support. The USAID-funded Enabling Health in Acholi project, thank you for the support. The United Nations Population Fund, thank you. USAID Social Behavior Change Activity and the World Vision International, thank you for the support. And the US-Uganda's Health Strengthening System Activity, thank you. We thank you sincerely for your endless support. On the list of recognition to those who have supported the service delivery in this sub-region, I wish to appreciate the efforts of all the different levels of health system structures in the Acholi sub-region. As I conclude my speech, ladies and gentlemen, I wish you a fruitful deliberation. It is now my pleasure, therefore, to officially inaugurate the renovated operating theater at Pajule Health Center for Acholi sub-region. For God and my country. Thank you very much. That is the minister's speech. Thank you so much for listening to me.
Thank you very much. Thank you, Dr. Moses Mwanga. Ladies and gentlemen, it has virtually come to an end. Our facility has been inaugurated. The American people have supported us, and we as the government and the peoples of Uganda, we have received it with open arms. Thank you, Your Excellency, and thank you very much. Ladies and gentlemen, we have come to the end of our function. Just one or two things to let you know. The RDC of Pade has informed me that there is a baraza after here, so he's requesting all his local leadership, the COW, LC5, DPC, and everybody to remain behind to attend to that. I'm also calling for the local leaders, meaning the district leadership of Pade and Kitgum. We have lunch prepared for you at Achaki, so please find your way to Achaki in Kitgum so that we can have lunch with you there. And for the rest of you, or the rest of us for that matter, because I'm not a district leader, remain seated here. We have prepared something for you as well before you leave. Your Excellency, thank you for coming. Thank you for taking time off. We appreciate your time. And please send our warm greetings to the American people. And we say thank you. And Johnny Masses when you take leave. Apoyo Matek. Thank you. Can we just stand up as the ambassador takes leave, please? All right. Hello. As Ambassador takes leave, I'm just informed now that we have Ladit John Pero Lugai, the Deputy Paramount Chief here amongst us. Ladit, you're welcome. And thank you for being with us. I'm sorry for this, but thank you for listening and attending. Apoyo Matak, Ladit. All right. Ladies and gentlemen, you will take leave after she has left our compound. Please be seated. Please take your seats. Please be seated. DJ, be watchful, be mindful, play something small. And the team that is coming to organize the lunch, you will also start taking charge of the ground after the ambassador has exited our space. Thank you, ladies and gentlemen, and thank you for coming, and journey masses to all of you. Afoya Matak.